health care between House and Senate Democrats in the Obama administration could be just hours away. In a late-night marathon session, President Obama and Democratic leaders said they broke through a major logjam in their disagreements that had been blocking the bill. The White House says it has cut a deal with organized labor on the Cadillac tax. Joining us now from Capitol Hill is Congressman Robert Andrews from New Jersey. And Congressman Andrews, what's your understanding about what the deal is?
Well, the deal essentially assures that no middle-class person is going to pay higher taxes as a result of this health care bill. It basically isolates the policies that are very, very lucrative, that are frankly held by very affluent people.
How quickly, first of all, do you think the CBO can score this and you can actually get down to votes?
I'm hoping we can vote within the next 10 days or so, maybe sooner. It's a tricky process to score this bill, but the CBO is really good. They got a lot of good professionals, and I'm sure they'll get the job done.
A number of Democrats are suggesting that health care is killing them. In fact, a North Dakota Representative Earl Pomeroy said the debate is hurting him so badly that he might as well retire if this drags on much longer. How fearful is the Democratic caucus over this?
Well, Earl's not retiring. He announced for re-election. Look, we're all worried. We understand we have a real uphill battle to overcome the distortions and misrepresentations about this bill. But we're going to go back to our districts and explain why we think it's good for the country, answer people's questions, and ask the key question, which is what would the opposition do instead? Would they turn back to decades of neglect of this problem, skyrocketing premiums, skyrocketing numbers of uninsured? This is not simply a referendum on us. It's a choice between us and the do-nothing, say-nothing opponents, and I think on that basis, we'll do just fine.
A number of Americans, one of the key questions they have as we start to pore over what's in this deal, a few weeks ago there was a suggestion that Americans would be able to buy into the same health care plan through the Office of Personnel Management, I believe, that you members of Congress have. Will that still be part of this?
Yes. Americans will be able to buy into a plan that's essentially similar to what federal employees have, and I think that's the right thing.
And what are some of the other aspects to this bill that you think as far as trying to sell it to your constituents, that you're going to be talking about?
If you're diabetic or you had breast cancer or asthma, the insurance company won't be able to deny you coverage or charge you more for it. If you paid your premiums faithfully for years and then you happen to get sick, the insurance company won't be able to cancel your policy. If you're a person who works hard 40 hours a week and can't afford coverage, you'll be able to. If you're a senior citizen that runs out of drug coverage in July or August, you're not going to run out of coverage. You're going to make it last all year eventually. These are things the American people want. They're in the bill, and I think when we focus on the fact that they're in there and compare it to the vacuum on the Republican side, that we'll be successful.
Fair enough, but the other concern that a lot of Americans have, if this mandate, if Americans do not buy into the system, is the IRS going to be coming after them?
No, the IRS isn't going to come after them. First of all, there is a mandate people have to buy insurance, but they get affordable subsidies that help them do that. It's reasonably priced. And, people have to have auto insurance to drive. This is a similar kind of situation. The insurance will be affordable. It's fair, frankly, to people who are paying for uninsured people right now who do use the hospitals and can't pay. So, look, I think this is fair. It requires everybody to take some responsibility. And we again say to people on the Republican side, what would you do differently? And where were you when you ran the place for the last 12 years?
Congressman Rob Andrews from New Jersey, a Democrat. Congressman, thanks for joining us this morning.
Thank you very much.